Okay, this test is to see whether or not the posterior hip capsule is tight or not. Obviously, if the findings on X-ray show that there's hip dysplasia, this is not going to refute that. But there's a lot of times when the posterior hip capsule is tight and gives similar findings on the table as hip dysplasia. So when you take the hip, you're going to go passively straight up towards the shoulder into full hip flexion. Brad's got great movement of his hip. If you have a tight posterior hip capsule, it shifts the head of the femur forward, and when you do this test, it pinches it up against the top of the acetabulum, and you'll get a sharp pain deep in your hip right here. If you then go and try to go towards the opposite shoulder, that'll make it probably 2 times as worse. The spot for where this tightness occurs, especially in marathon runners, is right here on the back side of the right here is the greater trochanter of the hip, and right through there. The stretch for it is to take the head of the femur and force it posterior and lateral with all of somebody's body weight, like that. And I'm pushing straight this way to stretch it. Can you feel that stretch?
Oh, yeah.
And that would probably need to be done for a month, and if it's bilateral, you do it both sides. Thanks.